this is kind of the quick and dirty here. If you found somebody that needed it, or if you yourself found like you were super drowsy, more often than not, it would be somebody that would be helping you. You tried to rouse them. You can do checking the airway, make sure there's nothing in their mouth. And this is how you would initiate CPR. So you would ventilate mouth to mouth. That would be while somebody was getting the Narcan ready. These are the sites, I don't know if you can see it, it's quite small there. These are the sites where you would ideally inject the Narcan. So thigh, buttock, or arm. Those are the IM spots, or muscular injection spots. So that's where it would be absorbed fastest. If, like, when in doubt, just kind of go anywhere. You could do tummy or like back of the arm, but ideally the deltoid, so right in the shoulder or top of the thigh, that'll act fastest.
Okay.
So you've got 3 vials of Narcan here and 3 syringes.
Mm-hmm. Oh, that's okay.
So each one is 0.4 milligrams. So the medication is in here. You snap off the lid.
Okay.
You take open a syringe and you just make sure the needle is in the solution in the vial, and then you pull back on the plunger.
Okay.
So once it's in here, then you would inject into the thigh or the shoulder.
Okay.
Does that make sense?
That makes sense, yeah.
If you've got time, and it's very stressful, so if you've got time and you're not panicking, you can expose the skin and wipe the skin first before you inject.
Okay.
But if somebody's not breathing, who cares about that? You just want to inject, and you can even go through clothing if it's a really big emergency.
Okay.
There are gloves in here, and this is the facial shield for mouth to mouth.
Okay.
So you've got 3 doses of the Narcan in here.
Mm-hmm.
You would wait about 2 to 3 minutes. If somebody is starting to breathe again nicely, you can hold off after that first dose, but always call 911 because the Narcan does wear off like within 10 minutes. It depends how much medication the person took,
Okay.
but can wear off like within 10 minutes.
Okay.
If their breathing doesn't change after the first injection, go ahead, repeat the same deal. So one more time, you would snap off the lid, take the syringe, pull back on the plunger until you've got the fluid in the syringe,
Mm-hmm.
and then you would jab them.
Okay.
Yeah.
And then if you're trying to administer it on yourself,
Yeah. So that, we do encourage people, if they're taking any opiates, to make sure they're with somebody, just
Okay.
in case.